Buenas tardes, mi nombre es Patricia Ornelas y soy proveedora de cuidado a domicilio de In-Home Support YOLO. Y yo soporto el 7%, el cual beneficia a todas las personas con necesidades especiales y a los ancianos, el cual les ayuda a darles un mejor servicio de calidad. Gracias por el tiempo que se están tomando en escuchar nuestras historias.
Gracias.
My name is Patricia Ornelas. I am an IHSS provider, and I'm urging the support of the permanent restoration of 7%, as it would improve the quality care for patients. Thank you.
Thank you.
Good afternoon. My name is Brenda Jackson. I'm a home care provider for Alameda County. I want to thank Reverend Lord. I want to thank Assemblyman.
Pray for us all.
Yes, Thurman for his support, and along with Assemblyman Bonte, that has always supported the IHSS program and our home care providers. Just a short story. A long time ago, my children, I used to have a forum that I would give all the girls in my neighborhood. It was called an open forum, and we would just discuss whatever was on their mind. And sometimes when I didn't have an answer for them, I would just draw a little map, a little road map, and it would say, every road's got to end somewhere. Here's a stop sign, here's this, and there's that. So my baby girl decided she would draw a circle. And she said, well, Mother, how are you going to get out of this? So I want to know, can we get a barrier to get out of that vicious cycle, that vicious circle that the IHSS program keeps going round and round and round about with the restoring of these hours? We need those hours to restore permanently and not keep doing this over year after year, year after year. I mean, we're here because we all have one thing in common, and that's we were all born with dignity. We inherited that, everybody in here. So let's have dignity amongst all of us. Let's think about, we're not just fighting for dignity, we're fighting for civil rights. We're fighting for human rights. And to continue this vicious cycle over and over and over, it's just mind-blowing for me. And it's cost-effective. It costs us too much money to keep doing this same thing over and over and over again. Thank you.
Thank you, Reverend.
Good afternoon. My name is Taffy Busica. I'm a volunteer for AARP. We have 3.5 million members in California, and we all are in support of the restoration. It's important to all of us. So, with over 3 million people in California, you can just imagine what it would be like, for our state. Thank you.
Thank you.
Good afternoon. My name is Brenda Blannon, and I'm a home care provider as well as an SEIU member. And I'd like to thank you for finally restoring the 70% back permanently. As you know, we do good work. We do more work than the nurses do. And we are not paid according to the work that we do. For instance, I keep my brother 24 hours a day. You only pay me for 117 hours. I have congestive heart failure, and I'm still working. I believe in this program so much. So I ask you to continue that 7% and later on even think about even raising it more, because we're doing good work. Thank you so very much.
Thank you.
Chris Jensen, Resources for Independent Living, and I think this will probably be my last time up here today. RAL provides services to Yolo and Sacramento counties, and so that's our area of service. I also wanted to mention that I didn't before is that we're members of the IHSS Coalition and fully support all of their suggestions, both for the issue previous, this issue, and the issue to come regarding the share of cost buyout. These are important issues. I was here during when IHSS was being cut. At one point, it was a 20% threat. It was litigated to an 8% with a 7% down the road. That 7% is now here. We're running a race, and I don't want to see us stop before we get to the finish line. So let's find a way to permanently restore that 7% cut to IHSS. Thank you very much.
Thank you.
Hảo, tôi là Lý Thao Kiên. Tôi哋強烈支持永久嘅恢復7%嘅資金、療金。多謝晒，多謝。
Thank you.
Hi, my name is Chiu Jen Lee. I strongly support the permanent restoration of the 70% of the funding that was cut. Thank you.
Thank you. Doje.
Hi, my name is Yeo Chi Yen. My full name is San Francisco. My English is a little bit. My support, 100% 公积. Thank you.
Thank you.
Good afternoon, Sylvia Solis Shaw on behalf of the City and County of San Francisco, specifically to item 2 under this issue. We have some concerns as outlined by CSAC and CWDA in their letter. We respectfully would like to see the trailer bill language proposed that has been proposed to be scaled back, as we feel that it is disproportionately unfair. So we would like to continue working with the committee and the other stakeholders in revising that. Thank you.
Thank you.
Michelle Rousey, Public Authority for HSS and Alameda County Advisory Board. When there's a 7% cut and or the 8% cut that was in place, us consumers have to make hard choices for what services of our IHSS that we have to cut. And honestly, whether to have a bed bath or not to have a bed bath in a day when you're extremely dirty is not a choice. It's not something that we want to have to choose. So, having the 7% restored and have a permanent fix to that is ideal for HSS consumers. We need a permanent fix to the 7% cuts because if we don't have that, we're constantly worried. And it is a worry that we're going to have that cut back on board, and we're going to have to choose which items out of our IHSS services that we're not going to be able to have for that day out of a month worth of services that, we shouldn't have to make those choices. Thank you.
Thank you.
Kim Rutledge from UDW, AFSCME Local 3930. I'm just here on behalf of the 90,000 IHSS providers and their consumers and families to thank the committee for the motion to permanently restore the 7%. We're here. I've been doing this job for 4 years, and year after year, we are here asking for a permanent restoration of this cut, and it's just, it feels good to finally get to this point and finally be able to tell our providers who work barely above minimum wage in most counties that they can care for the people that they need to care for in a more complete and dignified manner. So again, my sincere thanks, Assemblymember Thurmond and your committee for this.
Thank you.
My name is Herb Meyer. I'm chairman of the IHSS Public Authority Board of Directors in Marin County. Speaking for Marin County and our organization, I'd like to hope that the 7% won't be just a restoration, but it was there a long time ago, and let's just make it a permanent fixture. Let's not cut it. Also for my caregiver, Pascal Jean-Pierre, he's going to appreciate getting the extra 7% in a number of hours, and so will I, being a recipient. Thank you very much.
Thank you.
Joseph Berry again, just real quick. I just want to add that any tool that the IHSS representatives develop should be centered on a person-first, independent living type of model. It shouldn't be a health and human services model strictly and solely.
Thank you.
Gary Passmore, I just want to join Kim Rutledge. We advocates oftentimes forget to say thank you, and we thank you for the restoration that's occurred to date, and thank you for proposing that it be continued permanently.
Thank you.
I already testified, but I want to say one more point. I have a major concern about IHSS moving into the managed care system because the managed care system sees it from a medical model standpoint. We want to maintain the IHSS and all of these programs from a social model standpoint, and I am not the patient of my provider that I hire. And so I do get this in interviews when people are discussing people with disabilities. They refer to us as their patient. I'm not their patient. And so I'm very concerned about the managed care system coming in and seeing people from a medical model standpoint. So I'm concerned about the tool from that perspective and how much more expanded it is in other states where people are allowed to provide assistance to individuals based on that person's desires and needs. Thank you.
Thank you. We're going to move on to hear some of the proposals from advocates regarding IHSS. We'll consider that a nice segue into the next panel. Clearly the conversation about IHSS is not done. Neither is the conversation about the restoration of the 7% reduction. We are not yet to the mid-year revise. There'll be many, many other conversations, but this committee is making a statement about what it views as an important value of supporting on this issue. So know that there will be more in the conversation, but I'm very proud of the committee's actions here today. Thank you, and thank you to all the speakers. Thank you to our previous panel. Many of you will continue. We're honored to be joined by a few others who will speak to a number of advocates' proposals. I'm going to ask that we keep it really brief, just a few highlights, and want to welcome Herb Meyer on behalf of Speaking on behalf of Herb Meyer, we'll have Deborah Doctor. Happy to have you here. Kim, representing the IHSS Coalition. And we will also have Kim Rutledge, representing UDW, and AFSCME Local 3930, our Director Lightborn and his team, as well as Finance in the LAO's office. Ms. Doctor, if you'd like to open.
Deborah Doctor from Disability Rights California. Earlier in the afternoon, you heard from many people about the complete inadequacy of the SSI income level. And I'm here to talk to you about a small group of people who don't have as much as people on SSI. These are people who have to pay a share of cost, which brings their income down to $600 a month, not $889, $600. And this would be somebody who, say, has an income of $1,400, $1,400 a month because they have Social Security or maybe a small pension. And to qualify to get on IHSS, they now, since a thing called the IHSS share of cost buyout was repealed several years ago, have to spend down until they have only $600 a month to meet all their expenses. Housing, food, and everything else. Before this buyout was rescinded, they were able to spend down to the SSI level, which, as we all, I think, accept, is way below the cost of living in anywhere in California. These folks have to spend down to $600. So I'm here today to ask you to restore the IHSS share of cost buyout so that we don't penalize people who worked and thought that they would be a little better off and not have to rely on SSI, who find themselves in an untenable situation which forces some of them into nursing homes and prevents people who are in nursing homes from getting out if what they have to look forward to is $600 a month to live on. It's unconscionable. I'm happy to answer any questions, and thank you very much for considering the request.
Thank you. Ms. Rutledge.
Good afternoon. Again, Kim Rutledge with UDW, AFSCME Local 3930. Today I am here in yet another IHSS coalition, this time along with SEIU California, Disability Rights California, the California Association of Public Authorities, and the Congress of California Seniors to discuss the need for yet another change to the CMIPS-2 payrolling system to allow it to better serve IHSS recipients who are also enrolled in the Coordinated Care Initiative. When the CCI was originally created in 2012, the original legislation allowed health plans the ability to increase and pay for extra home care service hours for IHSS consumers who were enrolled in the CCI who needed extra services in order to remain safely in their own homes. However, there was no mechanism at the time set up to pay an individual provider of home care services for these additional hours. So the budget proposal that we're bringing forth today would fix this problem. We're requesting that the CMIPS-2 program the CMIPS-2 system be reprogrammed to allow the system to receive payments from the managed care plans in CCI so that an individual home care provider can be paid to provide these additional services if a health plan deems them necessary. The IHSS consumers who would be receiving these extra services are among the most vulnerable seniors and people with disabilities, in most cases dually eligible for Medicare and Medi-Cal in our state. If a health plan determines that an individual needs extra services beyond what they are already offered in IHSS, the IHSS consumer has the right to hire his or her existing provider or another individual provider of their choosing. This maintains the continuity of care, safety, and trust that have become the hallmarks of the IHSS program. Further, having this payment mechanism in place means that health care plans can more easily move forward with adding additional home care service hours for people in CCI. This is an added bonus of the CCI that will most certainly incentivize enrollment in the program for IHSS consumers who were previously reluctant to do so. Now that the passage of the MCO tax has secured the future of the CCI, we believe that this proposal is the next step in bringing this important aspect of the CCI to fruition. So for all of these reasons, we respectfully ask for the committee to consider this proposal, and I'm also open to any questions.
Thank you. Director Lightbourne.
First, I should like to ask Mr. Cervinka to comment on the sheriff cost buyout history.
So as Ms. Doctor indicated, this program had existed for a while and was eliminated in the budget reductions in the recessionary period. The $600 sheriff cost buyout, it's our understanding that is the sheriff cost standard used for the entire Medi-Cal program, and this buyout program was essentially created as a state add-on cost at 100% general fund cost to mitigate the impact of the IHSS program becoming a Medicaid program for certain recipients. So while, yes, it was a budget reduction, and 40 to 50 million, I think, is the number that we remember the value of that savings at the time it was eliminated. We also believe, from our colleagues in healthcare services at the time, that elimination of this program helped ensure compliance with Medi-Cal rules, that we have a standard share of cost policy across the entire Medi-Cal program, although there also are approved waivers within Medi-Cal that have different rules for eligibility. So there's a little bit of detail there behind the program. It was 100% general fund cost to buy out that share of cost, as she accurately described.
Thank you.
And in reference to the request for CMIPS-2 reprogramming, when we were looking or discussing the possibility of this a year plus ago, as I recall, the estimate for reprogramming costs was in the $7 million range, one-time costs. Thus far, we have not had any requests from managed care plans to increase home care hours. That isn't to say that won't happen. That's just informational.
I would interject here and say that last year when we were looking at this proposal, the reason that there hadn't been requests from the managed health plans was because they didn't see a mechanism for being able to pay a provider to do this, because specifically in the original CCI statute, there wasn't a way for them to do that. So it's kind of what, Director Lightbourne and I have talked about before as a chicken or egg situation. So.
Thank you. We're leaving these proposals open today. No, we're not taking any action. We do appreciate the insights that you all have shared. Did you have something else, Mr. Lightbourne?
If I could just close on the IHSS program overall, because in the course of different testimony, I wouldn't want us to sort of not be aware of the fact that the governor's budget does restore the 7% hours cut for budget year. In terms of the overtime FLSA-related restrictions, they affect a relatively smaller portion of the 500,000 consumers of service, or the 400,000 providers. And we will be shortly issuing direction around exemptions to allow for incurable circumstances that would otherwise place people in immediate risk. Thank you.
Thank you. Mr. Lee, anything from Finance? Anything from the LAO's office? Any public comment on this item? 1 minute each, public comment.
My name is Herb Meyer. I'm chairman of the IHSS Public Authority of Marin. Speaking both for that organization and for myself, I believe that share of cost should be greatly eliminated. As I mentioned before, I receive Social Security of $14.86. I receive aid from the VA. I receive a small check, $141 from DuPont Company, for a total of $2,668. My current share of cost is $1,301. That's close to 50% of what I receive. I still have to pay my rent, pay for food, pay for utilities, transportation, and my credit card debt, which I probably won't ever recover. Maybe I'll have to go to my death certificate or my GI insurance. Thank you very much.
Thank you, Mr. Chairman. Thank you.
Michelle Rousey with the Public Authority for IHSS in Alameda County, and also with the IHSS Coalition today. The IHSS share cost buyout, for some consumers, they choose not to. They choose not to be on IHSS because of that share of cost. I know many consumers that have chosen to not have a provider come in and pay them out of their own pocket on and off, instead of going the route of having an IHSS, being on IHSS. And for that, for me, when they have a high need, and for them to have to go on and live on with the low amount that they have to live on with $600 is not fair of our system. It's not fair of our system to make them live lower than the SSI and any other amount of income that they should be able to have here in this state. We have a proud state here, and for consumers to have to pay that much out of their share for a share of cost is just wrong. And I just want you to know that for us to have to, for those consumers who have that share of cost, and for the state to discontinue the buyout, we understand times are hard, but they shouldn't be forced on the backs of the consumers who need the very services that we have to provide in California. Thank you.
Thank you.
Again, my name is Connie Arnold, and I'm a member of the IHSS Consumer Union 2, which is numeral 2, which is a Facebook page started by Nancy Becker Kennedy, who's a quadriplegic down in Los Angeles. And I pushed for the restoration of the Medi-Cal buyout on that Facebook page. I pushed for this issue before the NFAH waiver technical expert work group, because we know, and I know personally, this is affecting people with disabilities and senior citizens either opt to not have services, or if they can't opt otherwise, are ending up either committing suicide or going into a nursing home. Like 2 people I know. One did one did the other. This is not right for our community to force people either those choices, and this needs to be addressed, and that people cannot live on $600 a month. I mean, there are other issues that we know need addressing, like the share of costs when somebody goes to a nursing home and they're on disability benefits and they take all their money as a share of cost, and they've got no home upkeep allowance if they're even told about it. So, you know, we need to address this issue. And then we also need to add more nursing facility acute hospital waivers, like 20,000 of them, okay, slots, because right now there's a waiting list. So we do need to address these issues. Thank you very much.
Thank you.
Just real quick, I would just say that I know that they're not taking a position on the issue today as far as the share of cost buyout. However, I would just say it should be taken up as soon as possible because effectively, as you know, what it's doing is it's targeting, and I would say illegally discriminating against persons with disabilities from obtaining work or going to work. Not to mention the fact that people who are of able body and mind who become disabled out of the blue. These people are, such persons are being, I would say, unfairly discriminated against and targeted for, you know, you're basically being punished for working, and that should never be a policy of ours.
Thank you.
Hi, my name is Susanna Saldana, and this is what I really wanted. Glad they're talking about this. But my question is, or it's like, I have a son that requires 24-hour care, so I get in-home services for him, but yet my husband becomes disabled, and the doctor, we took him to the doctor said he needs a lot of help, that she called IHSS, send paperwork, he qualifies for IHSS hours. Well, then the IHSS 6 weeks later says, oh, he doesn't qualify anymore because you have too much hours for your son. He doesn't get Medi-Cal anymore. They took the Medi-Cal away. So it's a share of cost of $1,200, and then they'll pay some hours for him to get care. Is that the share of cost that also is all the same, or because he does get Social Security? He's supposed to get, he gets Social Security for his disability. And I feel it was unfair when they changed from Medi-Cal and then made you go somewhere else to apply for Medi-Cal, then you got to tell them all your income. But because I tell you my son is 24/7 and get 270 hours for him, no, okay, so now I can't care for my husband, which needed a lot of help. I was taking care of him, going, my husband helping him lift him up, and he has to go to the bathroom, and then my son's, Mom, I got to go to the bathroom, and going back and forth, and it's a lot of work, but you still have to do it, and then all of a sudden, oh, you make too much hours. Is there some way that it can be fixed where I could take care of both without having a share of cost?
Thank you. And I saw Director Lightbourne and others nodding their head. If you want to get an answer on the record, we appreciate the question. Thank you.
Thank you.
Ms. Carroll.